Hello, everyone, and welcome to our question lab. We're happy to have you here. This evening, we will be covering public health science as a topic we have not yet done in any of our question labs. We're excited to do these 4 questions with you this evening. Leading today's question dissection is Dr. Paras Vicaria. Paras, you want to introduce yourself?
Sure, thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident at UT Southwestern here in Dallas, Texas. I originally graduated from pharmacy school in St. Louis, Missouri, and then did medical school back home in Michigan. I've worked with USMLE-Rx as an RX coach for a little over a year now, working one-on-one with students in regards to the USMLE Step 1 and USMLE Step 2 CK, and excited to lead today's session.
Excellent. As always, we're happy to have Paras with us today. If you guys look at your control panel, you'll see a question box, and that's where you can ask our panelists questions. And we have some wonderful panelists for you. We have Kate and Jeff, who you'll meet later, and one of our other RX coaches, Kasha. Kasha, you want to introduce yourself?
Sure thing. Hi there. My name is Kasha Bornstein. I'm a fourth-year medical student at the University of Miami. And I've been working with Coach RX for just about 7, almost 8 months now, working with students mostly on Step 1, Step 2 content, and also on their class content. I love working with students, trying to get them towards achieving their dreams. Thanks, Sean.
Excellent. Thank you so much, Kasha. We're happy to have you here. RX Coach is our new one-on-one tutoring program, which we use to individually help students in medical schools on their medical school exams, on their comprehensive basic science self-assessment exams, Step 1, Step 2, as well as the COMLEX. So we'll talk more about that here in a little bit. My name is Sean. I've been with RX Coach for going on about 2 years now, and we're happy to have all of you here. Now that you've had a chance to meet us, we would like to have the opportunity to meet you. So I'm going to ask you guys a question, and I'll give you guys a few seconds to respond to who are you? So we'd like to know who you are. So please take a minute to give us your response, and then keep in mind that this is the same poll format that you will see with each of our 4 questions this evening, and you'll have an opportunity to submit your answers before we go over the correct and incorrect answers together. So we'll give you guys a few more seconds here, and then we'll get started with our first question. You know, we'd also like to know, where are you from? So feel free to let us know in the question box where you're from. We'd love to know. All right, looks like a lot of you guys have voted. Let's take a look. All right, looks like we have a lot of international medical students and graduates, and a lot of US and Canadian born international medical students and graduates, and of course some US, Canadian DO and MD students. So we're happy to have all of you here. You know, we're always curious, and we'd like to ask our students, you know, how many additional resources are you using to supplement your learning? So these are in addition to your class and professor lecture notes. So how many resources in addition to your class notes are you using to study for your exam? Looks like we have a couple people, Kasha, from Miami. It looks like we're neighbors. Excellent. We'll give you guys a few more seconds to respond here, and then we'll get started with our first question. Keep in mind, please, that starting on November 10th, so not the next question lab, but the one afterwards, we are going to be pushing our time 2 hours. So it'll be 8 p.m. Eastern time as opposed to 6 p.m. Eastern time, okay? And we'll remind you guys of that, of course, via email. Let's take a look and see what you guys said. So it looks like almost everybody here is using additional resources, and it looks like a bulk of you guys are using between 3 and 5 additional resources to supplement your learning, okay? And we'll talk a little bit about at the end how you can kind of consolidate those resources and avoid having to flip back and forth, because I know sometimes using many resources can become challenging, can become overwhelming, and cause a little anxiety and stress, and maybe even cause you to become a little unorganized. So we'll talk about that here at the end, right before we do our raffle. So make sure you stick around because you must be present to win. Like I said, Kasha, Paras, and myself, we all work with RX Coach, and RX Coach is our new one-on-one tutoring and coaching program. And we'll talk more about that later, but for now you should know that the methodology we're going to be using in all 4 of our questions this evening is the same methodology that we employ in our RX coaching sessions. So with that, let's go ahead and get started with our first question on public health sciences. Now, as you guys can see, the answer choices, and that is by design. We cover those up as part of our first step, and the reason we do that is because we do not want the answer choices to guide or dictate your thought process. We also don't want you guys to see an answer choice that you're unfamiliar with, and that causes you to maybe to panic as you're trying to answer that question. So we remove those answer choices for now, and once we do that, we will go ahead and read the lead-in, and the lead-in is the last sentence or the question itself. So we'll read that together now. Which following biases prevented the physician from obtaining the correct diagnosis initially? Which of the following biases prevented the physician from obtaining the correct diagnosis initially? And at this point, we'd like to ask our students 2 questions. The first question is, how many steps do you think this question will require? And number 2, what do you think are the most important keywords in this lead-in? So we'll give you guys a few seconds to respond in the question box and let us know how many steps you think this will require and what the most important keywords are. And then we'll go ahead and read the vignette or the question stem together. So we'll give you guys a few more seconds to respond. All righty. I see the responses coming in. So let's go ahead now and read that lead-in. A 62-year-old woman comes to the emergency department because of a burning sensation in her chest along with nausea. She had 1 episode of vomiting and denies any sharp chest pain. Her past medical history is unremarkable. Recently, the physician has seen several cases of gastroesophageal reflux disease or GERD, all with similar presentations to this patient. Assuming this patient also has GERD, the ED physician prescribes once daily omeprazole and discharges the patient without any further evaluation. The following day, the patient presents back to the ED complaining of chest pain unrelieved by the omeprazole. Electrocardiography discloses ST segment elevations in leads 1 and AVL. Coronary angiography confirms a myocardial infarction. Which of the following biases prevented the physician from obtaining the correct diagnosis initially? Now, in our coaching session, stop after every sentence and ask you what are the key words, what are you thinking, to make sure you have a good thought process. Since we can't do that with you all individually today, why don't you guys take a second and let us know what you think the most important keywords are in that vignette. We'll give you guys a few seconds to respond, and then Paris will go over the answer choices. We'll give you guys a few seconds here to submit your responses in the question box. All right, I see some of the responses coming in. We'll give you guys a few more seconds. All right, Paris, take it away.
Thank you, Sean. So we'll go ahead and tell you what we thought were the important clues in both the lead-in and the vignette. So in the lead-in, as we can tell, that this is kind of getting at a bias question. So there might be some bias going on that prevented the physician from obtaining the correct diagnosis initially. So when we look at that vignette, obviously we want to take in the clinical picture, but also figure out if there's anything that could be related to any kind of bias. So epidemiologic or demographic information, so 62-year-old woman, what are her signs and symptoms? Well, she has a burning sensation in her chest, along with nausea, vomiting, denies any sharp chest pain. And I think that may have been important for this physician. So this physician maybe thought that, and then had also seen several cases of GERD with similar presentations. So then this physician assumed this patient also had GERD because he had seen several cases of this recently. So the physician discharged the patient without any further evaluation. The following day, the patient presents back, has a STEMI or MI. And so that's kind of, here maybe the clinical information isn't as important, except, knowing that she was diagnosed initially with GERD, but actually had an MI. But I think it's always helpful just to keep the clinical information in mind. So having done that, let's take a look at the answer choices and take a look at what we are dealing with. What are the potential answer choices? So first of all, we're going to start at the bottom and work our way up. And so we're going to start with answer choice E and work our way to the top. The reason we like to do this is because this ensures that you get through and read all of the answer choices and that you don't bias yourself by seeing something you like early on, selecting it, and not getting through all the answer choices. So we'll go ahead and do that. This is answer choice E, unpacking effect, D, framing effects, C, blind obedience, B, availability heuristic, and A, anchoring heuristic. Now, when talking about how many steps this question could be, this is probably a one-step question. You know, knowing what is going on in this question, what's the name of the bias this physician had in this specific instance, and I won't talk too much more about that. But we'll go ahead and open up the poll so you guys can select.
Excellent. So we've gone ahead and opened up the poll here for you guys. So take a second to select the answer choice which is correct, and then Boris will go over the correct and incorrect answer choices. So we'll give you guys a few seconds here to submit your responses. I see the answer choices coming in. We'll give you guys a few more seconds here, make sure everybody has a chance. Remember that on test day, there is no penalty for guessing, so you should never leave a question blank. All right, looks like this question is giving some of you guys trouble. We have a pretty even split with these choices. So let's see what you guys came up with. And it looks like most of you guys picked answer choice D, which was framing effects, and in second place was answer choice A. So let's go ahead and hand it off to Boris. But before we do that, let's take a look at the correct answer. And the correct answer is B, available heuristic. And it looks like 21% of you guys got that right. I know these public health science questions can be challenging, but don't worry, Boris is going to explain to you why this is the correct answer and why the other ones are incorrect. Boris.
Thank you, Sean. Yeah, definitely a tough question here. So it's nice that we're able to review this topic today. So essentially, like we had mentioned, this patient, the physician assumed this patient had GERD because he had recently seen several cases of GERD that looked very similar to this. However, this patient actually ended up having a heart attack or a myocardial infarction. So this is known as availability heuristic. So the diagnosis is based on experience with past cases. So it's kind of a bias in that the physician was making a judgment about what this patient had based on recent events that he had seen, or in specific to medical, recent cases and diagnoses that he had seen. So this physician thought that the patient was describing GERD because of burning sensation, nausea, and also denied any sharp chest pain. However, the physician really should have looked at this case in and of itself and take every patient as a case-by-case basis and not allow the previous patients that he had seen to bias this patient's presentation. So this is called availability heuristic bias. Now, I know we had selected a few of the other answer choices, so let's take a look, or let's talk about why those are incorrect. So E, unpacking effect. This is when the physician fails to get information, so it leads to misdiagnosis. Thus, the way to think about it is they have not unpacked all of the information in the presentation or the box. In this question, I think the physician did get a lot of important information: chest pain, nausea, denies sharp chest pain, and really a diagnosis of a heart attack is a lot of times with diagnostic testing as well, which the physician didn't get at that point. But the physician did ask the appropriate question, so this is likely not unpacking effect. D, framing effects. This kind of doesn't really fit too well with this question, but I'll try my best to explain it. This is basically another type of bias where the decisions you make are biased by how the information is presented to you. So one example that I remember is if you were to tell a patient that Soap kills 99% of all of the germs on your hands, versus if you were to tell a different patient that soap allows 1% of bacteria to live on your hands, which of the following patients would be more likely to buy soap? And the patient, I would say it's the first patient, because to them it's presented that it's killing 99% of bacteria, versus in the second patient, you're saying that, well, 1% are still surviving. So that's kind of a good example of framing effects in the way that the information is framed to the patient or the physician affects the diagnosis and treatment. So that's not really what's going on here, but for some of you who weren't familiar with what framing effects were. And I think that was the most highly selected answer. Answer choice C, blind obedience. So this is when, in a medical scenario, when physicians really just rely on test results or someone else's expert opinion on diagnosis, without really taking into account physical exam findings or clinical information. So if the EKG was done and that had shown that a patient had a heart attack, maybe had some ST elevations, but the patient had no clinical information or any chest pain whatsoever, maybe you want to, incorporate some of that clinical information instead of just blindly following lab results or other people's expert opinions. And that's actually kind of the opposite of what's going on here. But that would be an example of blind obedience and not necessarily what's going on here. We talked about answer choice B, and answer choice A, or anchoring heuristic, also would have been maybe another good answer choice that people may have selected, but this is also a bias where, again, in the medical setting, where physicians rely on their initial diagnostic impression. So they get anchored to their initial diagnosis, and even if they get subsequent information that contradicts that, they still stick with their initial diagnosis. So an example in this type of situation would have been a patient who had GERD. The physician thought they had GERD, comes back, has an EKG that shows ST elevations, has an angiography that shows an MI, but the physician were to still think that the patient has GERD, even in the setting of those information that contradicted it. That's not what's going on here in this question. The patient ended up diagnosed with an MI, so this would not be an example of anchoring heuristic bias. But it's important to try to use some of those words and the types of biases to kind of help you remember what kind of bias it is, whether it's not unpacking the information, blindly following something, being anchored down in your diagnosis. And I usually found that has helped me with these different types of biases.
Excellent. Thank you, Paris. Great explanations. I hope you guys followed along. Tough question, but let's see if we can't do better on the next question. So here is our second question of the evening. As always, you will see that the answer choices are covered up. That is by design for those of you just joining us. It's the first thing we do because we do not want the answer choices to dictate or guide your thinking. And once we cover that up, we will read the lead in together. So here we go. Which of the following additional findings would most likely be present, assuming that he is meeting his developmental milestones? Which of the following additional findings would most likely be present, assuming that he is meeting his developmental milestones? So with that, I'll give you guys a few seconds to let us know in the question box what the key words in the lead-in are and how many steps you believe this question will require. We'll give you guys a few seconds here to respond. All right. I see the response coming in. So let's go ahead now and read that vignette. A very young boy becomes visibly upset when the physician enters the room. The child's mother reports that he is doing well and is beginning to make sounds that resemble him trying to speak. She also says that he can pull himself up to stand and can walk with help. He is able to grasp an object with his index finger and thumb. When the examination begins, the child starts to cry and withdraws further into his mother's lap. Which of the following additional findings would most likely be present, assuming that he is meeting his developmental milestones? So we'll give you guys a few seconds here to let us know what the keywords are in the question stem. And for those of you asking where you can find this information, don't worry, at the end, I will show you the question IDs and you'll be able to log in to RX or our question bank, type in that question ID and get these explanations so you can review them afterwards. All right, I see some responses coming in. So with that, I will go ahead and turn it over to Paris.
Thank you, Sean. So we'll go ahead and tell you what we thought were the important clues in both the vignette and the lead-in. So in the lead-in, they're telling us that, additional findings to most likely be present. So we know that the answer choices are probably going to be something additional that we're going to have to remember from our memory bank. And then obviously assuming he's meeting milestones. So in the vignette, they tell us it's a very young boy. I think that's important. They avoided telling us the age, which is obviously important here. And they give us a few things, a few clues. He's upset when the physician walks in. He is trying to speak. He can pull himself up to stand and walk with help, but can't walk unassisted, it sounds like. He can grasp an object with his index finger and thumb. There's a specific name for that we'll talk about. And then the child starts to cry even more when the exam begins. So a lot of clues about potential milestones that we need to be considering when we're trying to figure out this question. So how many steps could this question be? I think this is probably a nice two-step question where one, we need to incorporate and collect all this information about milestones to try to figure out a potential age of this young boy. And then two, what would be an additional finding that you would see based on the age that you think this young boy is? So I think this is a two-step question here. So let's go ahead and take a look at the answer choices. And again, we'll start at the bottom and work our way up. This way we'll make sure we're getting through all the answer choices, especially an important question like this. Answer choice E, can stack 6 cubes. D, can roll and sit but not crawl. C, can ride a tricycle. B, can feed self with fork and spoon. And A, an upward moving great toe with fanning of the other toes when the bottom of the foot is stroked. So we'll go ahead and open up that poll and then go ahead and select the answer choice that you think is correct, and we'll talk about it in just a few seconds.
Excellent. So I'll read these to you because some of these are a little long. E, can stack 6 cubes. D, can roll and sit but not crawl. C, can ride a tricycle. B, can feed self with a fork and spoon. And A, an upward moving great toe with fanning of the other toes when the bottom of the foot is stroked. So we'll give you guys a few seconds here to submit your responses, and then Paris will go over the correct and incorrect responses. So I'll give you guys a few more seconds here to submit your responses. All right. Looks like we're getting a lot of responses here, so we'll give you guys a few more seconds and then we'll take a look and see how you guys did. All right, let's take a look. Looks like 38% of you guys picked answer choice A, which is an upward moving great toe with fanning of the other toes when the bottom of the foot is stroked. And in second place was answer choice B, which was can feed self with fork and spoon. Let's see what the correct answer is. And the correct answer is A, and 38% of you guys got that right. So better than last time, so well done. And with that, I'll turn it over to Paris.
Thank you, Sean. Yeah, great job, guys. This is also a tough milestone question. So let's talk about this. So, we won't repeat all the clues, but they gave us a lot of information there that we've highlighted in green again. Of note, grasping an object with his index finger and thumb, that's called a pincer grasp, okay? He's able to pull himself up, but needs help to walk. And the thing that they're getting at when he's getting upset when the physician enters and crying further during the exam, that's called stranger anxiety. So this is giving us some clues about his age. So we know that this child is most likely less than 15 months because he can't walk unassisted. Stranger anxiety, as we mentioned, usually starts at around 7 to 9 months. The pincer grasp starts at around usually 10 months. And the fact that he can stand and walk with assistance, but not yet on his own, suggests maybe 10, at least 10 months of age, but less than, not older than 12 months. So that movement in answer choice A, that's actually called the Babinski sign, and that's a normal finding in infants before the age of 12 months because their corticospinal pathways are not fully myelinated. If that were to be an adult or an older child, that would be pathologic. Okay, so I think on the next slide, Sean has actually pulled up a really nice table of milestones. So as you can see here, 0 to 12 months. If you look at some of the milestones of around 12 months of age, you can see Babinski sign is still present disappears after 12 months. They can stand by 10 months and walk by 12 to 18 months. Again, the pincer grasp by 10 months. And then other things as well for older age groups. So we know, as we mentioned, that this is probably somewhere between age 10 to 12 months old. So we'll stay here on this table, but I'll go ahead and read some of the other answer choices so you can see where it falls on this table and why it would be an incorrect answer. So answer choice E was someone who can stack 6 cubes. So as you can see there, in the second column on the very bottom row, cube stacked in terms of number is age times 3. So if they were to say, can the child stack 6 cubes, that means they would have to be 2 years of age. And again, we've determined that this patient is somewhere between 10 and 12 months. Answer choice D was can roll and sit, but not crawl. And you can see there, again in the second column, but in the first row, rolls and sits is characteristic of 6 months of age under the posture. Someone who can ride a tricycle, this was answer choice C. This is something that usually is done by age 3, okay? And then answer choice B can feed self with a fork and spoon. As you can see there, again, in the motor column, in the 12 to 36 month row, that would fall under cutlery. Someone who can feed self with fork and spoon is someone who's 20 months. So you can see there, this is a lot of information coming at you, but important to know where all of those different potential milestones fall, and then to use the information they gave us to determine that we think our patient is 10 to 12 months, and by that, they probably still have the Babinski reflex. And that's why answer choice A was a correct answer choice in this question.
Excellent. Thank you, Paris. So, great job to you guys who got it right. Those of you who didn't, I'm sure that explanation helped. And of course, we went ahead and provided this slide, and you can see that it's on page 635 in First Aid version 2020. So be sure to take a look at that because it is an important chart. With that being said, we talked about RX Coach earlier, and I want to ask you guys a question. And the question is, how would you describe the results you are seeing after your study sessions? A, I am seeing great results and I am happy. The results do not match my efforts. C, I am plateauing. Or D, I am spending too much time and falling behind. Take a second to let us know which one of these describes your results after study sessions. I see the responses coming in slowly. We would appreciate all of you guys submitting a response. So please do take a second to let us know which one describes your situation best. All right, we'll give you guys a few more seconds here. I see them coming in slowly. All right, looks like over half of you guys have submitted your responses. Let's go ahead and take a look and see what you guys said. So it looks like a third of you guys are saying, I am seeing great results and I am happy. Well, that's wonderful, and we're happy for you. But it looks like 67% of you guys are not very happy with their study results. And that's perfectly normal. And as you guys can see, you're not the only ones. If you submitted that answer, you're not the only one, right? You have 67% of people in this audience who also share that sentiment. So if you're plateauing and the study efforts are not matching, the results aren't matching your efforts, or if you feel like you're stuck, well, then you have to do something different, right? Because you can't keep doing the same thing and expecting a different results. And one of the things you can do help of a certified RX coach through our RX coach program. What we do with RX coach, the first thing we do is we administer an assessment exam that we created. And that assessment allows us to really pinpoint your strengths and weaknesses. Once we have that, we come up with a study plan based on you, your strengths and weaknesses, your learning style. And then once we give you that study plan, we work with you at regular intervals to make sure that you are learning the material and that you're able to apply it and can dissect questions and answer questions correctly on test day. So it's a very holistic approach that we take, starting with building the foundation of knowledge all the way to executing and applying that knowledge on test day. And we've had a lot of success. You see two testimonials here, one testimonial from a student who graduated in 2007, and another student whose score went up 73 points. So we've worked with students from all walks of life. So if you need that extra assistance, remember, you don't want to walk out of that test and say that you didn't give it your 100%. You want to leave everything on the table and do everything you can to get that step score, especially for the international students here, of which we have a majority. It's really important that you do well so you can be competitive and get that residency you want. The last thing you want to do is take your step and underperform and not get that residency, because remember, once you pass that step, you can't take it again, right? So we highly encourage you to consider making the investment in an RX coach. We've had a lot of success. Our student satisfaction after over thousands of sessions is a 4.9 out of 5. That should tell you how happy our students are with the sessions and with the results. And we have wonderful coaches like Boris and Kasha who can assist you and help you maximize your potential on test day. So if you're interested in receiving that help and maximizing your potential, and not to mention studying more efficiently, right? Because if you have a study plan catered to you, you're going to be more efficient. What your friend did or what your classmate did or what you read online may not be your best approach. And that may cause you to waste additional time that you may or may not have. So visit us at rx-coach.com. That's rx-coach.com. And sign up for a free consultation to discuss the tutoring program and how it can benefit you. If you want general study advice, please visit us at firstaidteam.com. All right, so with that, I will go ahead and move on now to the third question of the evening. Once again, a friendly reminder that starting on November 10th, we will be pushing our question labs 2 hours. So we'll start at 8 p.m. Eastern time as opposed to 6 p.m. Eastern time. So make sure you keep that in mind, and make sure you stick around until the very end, because at the end, we're going to show you how to consolidate some resources, as well as give away a raffle. We have a raffle and we're gonna give away a prize, and you must be present to win. So with that, let's go ahead and move on to our third question of the evening on public health sciences. So once again, the answer choices are covered up, and we will begin with the lead-in. What is the most appropriate way for Dr. Jones to respond to this patient? What is the most appropriate way for Dr. Jones to respond to this patient? Once again, I'll give you guys a couple of seconds to let us know what you think the correct answer, what the most important keywords are, and how many steps you believe this question will require. All right, and with that, we'll go ahead and read the lead-in. Dr. Jones, a medical oncologist, is seeing a patient who has been diagnosed with breast cancer. As he begins to take the patient's history, she interrupts and states, "I can't stand Dr. Smith. He is a lousy surgeon and he doesn't know how to treat people. Next time you see him, tell him he has made his patients extremely angry and should learn how to become a better doctor." What is the most appropriate way for Dr. Jones to respond to this patient? And with that, I will turn it over to Boris. Boris.
Thank you, Sean. So this is a nice medical ethics question. So in here, I've kind of highlighted what I thought were important. So Whenever you see the most appropriate way to respond, I think you can gather that this will be an ethics question. So we do know, obviously, that Sean mentioned that the patient interrupted the physician to tell him about a different surgeon, and that she is requesting that you tell him a statement or a request. So what is the most appropriate way to respond? Obviously, I think this is a one-step question in terms of steps, but let's talk about, let's look at those answer choices. And I think this will be more of a discussion based on after we answer the question. So answer choice E, I am sorry that you had a bad experience. I hope that I can better address your needs today. D, I will bring up the issues with Dr. Smith in our next meeting. C, I understand you are upset, but I suggest you speak directly to Dr. Smith regarding your concerns. B, Dr. Smith is an excellent doctor. He does a great job with all of my patients. And A, do you think I have treated you appropriately? So go ahead and select the response that you would respond to the patient with, actually, and we can talk about which is the most appropriate way to respond in just a few seconds.
I'm going to go ahead and read these answer choices to you again because I know they're truncated in our poll. So here we go. E, I am sorry that you had a bad experience. I hope that I can better address your needs today. D, I will bring up the issues with Dr. Smith in our next meeting. C, I understand you are upset, but I suggest you speak directly to Dr. Smith regarding your concerns. B, Dr. Smith is an excellent doctor. He does a great job with all of my patients. And A, do you think I have treated you appropriately? So we'll give you guys a few seconds here to respond, and then we will go over the correct and incorrect answer choices in just a second. All right, I see the answer choices coming in. A few more seconds here. All right, let's see what you guys selected. So it looks like 59% of you guys picked answer choice C, which was, I understand you are upset, but I suggest you speak directly to Dr. Smith. And in second place, with 39%, was E, I am sorry that you had a bad experience. I hope that I can better address your needs today. So let's see what the correct answer is. And the correct answer is C, and 59% of you guys got that right, so well done. I understand you are upset, but I suggest you speak directly to Dr. Smith regarding your concerns. And with that, I will hand it back to Boris.
Thank you, Sean. Great job, guys. This is actually a little bit of a tough question. So you are correct. In this scenario, the patient is expressing concerns about another doctor, and it's important to acknowledge their concerns, but you don't want to do anything to pass judgment on another patient-physician-doctor relationship. And the appropriate thing to do would be to have that patient address their concerns with that physician. If they feel uncomfortable doing that, then you can provide information on how to meet with a hospital patient advocate or someone else who would be an appropriate person to discuss that with. If it's someone with a member of your office staff, then you can speak to that individual. But in this case, this is a different physician. And again, it's not appropriate to try to mediate conflict between a patient and another physician. So that's why answer choice C is correct, because you're acknowledging that they're upset, but you're kind of staying out of that patient-physician relationship. And let's talk about the other answer choices as to why they're incorrect. Answer choice E, which I believe was the second most highly selected answer. So when you see this, it may be tempting to try to console the patient and reassure them that today's visit with you will go smoothly. However, by doing this, it's kind of passing judgment on the interaction with the other physician and patient. And that's not something you want to do, as mentioned. So this is something that would actually be incorrect. I think the first part of that statement might be correct, but I saying that you can better address something is saying that the previous physician did not do a good job, or you're validating that patient is saying that physician's bad, which you don't want to do. Answer choice D, I will bring up the issues with Dr. Smith in our next at our next meeting. And again, as mentioned, you don't want to try to mediate issues between patients and other physicians, so that would be incorrect. B is, I don't believe anyone selected this, but saying he's an excellent doctor and does a great job with all of my patients, you're kind of dismissing the patient's concerns there, and you're not acknowledging that they have an issue. And that could damage your patient relationship with that patient. So that's not something you would want to do. Answer choice A, do you think I've treated you appropriately? It is important to ask patients for feedback, but this is probably not the time or place to do it. When the patient tells you about another doctor, this is something that you can do at a different time to gauge feedback, but this is not the right time to propose that question to a patient. So keep in mind that ethics questions can be pretty difficult. Usually it'll come down to one or two statements that you'll really have a tough time with, kind of like in this question. And it's important to just remember what the tenets of ethics are and what things you should and should not do, and always try to remember those to guide your answer choices.
Excellent. Thank you, Parth, for the wonderful explanation. Great job, guys. That was one of the high percentages correct that we've had in all of our question labs. So well done, everyone. So let's go ahead and continue and keep that momentum going with our last question of the evening on public health. We're going to start with that lead-in. Which of the following is the most appropriate initial question to ask this patient? And by now, you guys have been here, so you guys know I'm going to ask you to let us know how many steps you require and what the most important keywords are. So please go ahead and do that. And we'll go ahead and move on to the question stem here shortly. All right. A 63-year-old woman comes to her primary care physician because of increased shortness of breath. She says, "I just can't keep up like I used to." The patient has a history of type 2 diabetes mellitus and hypertension. Current medications include hydrochlorothiazide, amlodipine, and metformin. Height is 165 centimeters and weight is 76 kilograms, 3 kilograms more than she weighed 1 year ago. Blood pressure is 149/88, pulse is 88, and respiratory rate is 16. BMI is 28. Which of the following is the most appropriate initial question to ask this patient?
Thank you, Sean. So again, we'll kind of talk about what we thought were the important key phrases in the vignette and the lead-in. So in the lead-in, we thought it was most appropriate initial question. That's what we had highlighted in the lead-in. So what is the most appropriate initial question? Now in the vignette, the things that we thought were important was this was a 63-year-old woman. She has increased shortness of breath. She just can't keep up, she just can't keep up like she used to. She's diabetic and has a history of diabetes and hypertensive. And she has a little bit of elevated blood pressure on physical. So let's take a look at the answer choices, and I think that will kind of guide you in what type of question this is. I would say that this is probably a one-step question, figuring out which of these questions to ask this patient. And again, we'll start at the bottom and work our way up. How is your quality of life compared with your quality of life 1 year ago? D, how have your symptoms been affecting your life? C, have you been struggling with walking up the stairs or carrying groceries? B, can you tell me about your diet on a typical day? A, are these symptoms affecting your daily activities? So go ahead and select the question that you would like to ask this patient as the very first initial question, and then we'll talk about it in just a few seconds.
Excellent, thank you, Paris. I'll go ahead and read these answer choices to you one more time because some of them are a little long. E, how was your quality of life compared with your quality of life 1 year ago? D, how have your symptoms been affecting your life? C, have you been struggling with walking up the stairs or carrying groceries? B, can you tell me about your diet on a typical day? And A, are these symptoms affecting your daily activity? So we'll give you guys a few seconds here to submit your responses. And make sure you guys stick around until the very end for raffle. Keep in mind that, like I said, starting November 10th, we are going to be moving our question lab to 8 p.m. It will still be 1 hour long, but it will be 2 hours later than it is currently. And that will start on November 10th. So make sure you guys make a mental note. But like I said, we will remind you via email. All right, I see the answer choices are coming in. Let's go ahead and take a look and see what you guys selected. Looks like 30% of you guys picked D, however, symptoms been affecting your life. And in second place was A, are these symptoms affecting your daily activities? So let's see what the correct answer is. And the correct answer is D. How have your symptoms been affecting your life? And 30% of you guys got that right. So well done to those of you who got it. To those of you who didn't, don't worry. Boris is going to explain it to you now.
Thank you, Sean. So, yep, this is definitely another tough questions, and these kind of questions can be tricky. So, the one thing we know is that this patient is an elderly woman who is, just saying she can't keep up like she used to. So, when you're asking an initial question, the first thing you should, in these types of questions, in these type of questions that you'll get asked, you often want to ask the patient an open-ended question. Meaning, when you ask the patient a question, would their response be a yes/no response, or would they have to respond with something descriptive? So, answer choice C, for example, have you been struggling with walking up the stairs or carrying groceries? That's a closed-ended question. They would basically just respond yes or no with that. And that's not the first question you want to ask. You can maybe ask that later on, but the first question you want to ask is open-ended. Tell me about your day. How are your symptoms affecting your life? This way they can describe to you appropriately in their way what's going on with them. So that's why answer choice D would be a good initial question, because it's eliminating any bias from the questions that you could ask. So when we're talking about the other answer choices A and C are both closed-ended. The patient would respond with a yes or no answer, and that's not something you want to do with your first initial question. Answer choices E and B, those are actually open-ended questions as well. So the patient would have to tell you about their diet, they'd have to tell you about their quality of life now compared to a year ago. However, they're a little bit more, the answer choice B is a little bit more focused just specifically on diet. And that's kind of a little bit too narrow to ask as your very first question. And answer choice E is kind of vague, and it's not really addressing what's going on right now. So the more appropriate question would be an open-ended question that allows the patient to describe what's going on with her right now, which is how have your symptoms been affecting your life? So again, these kind of questions can be tricky, and this subject that we did today that Sean had selected is a great topic to review, because a lot of times it comes down to two answer choices, and you just have a tough time picking between those two things. So hopefully this session was helpful for you guys today.
Excellent. Thank you very much, Paris. Great job, everybody. We averaged today 37% correct on these questions. And for those of you who are thinking, I can learn that later, I'll brush up on my question answering skills later, I'll study the subject later. Remember, later can sneak up on you, and you may think you have a lot of time to study, but then that time can be spent inefficiently, and you can be pressed for time as a result. So if you're struggling, and you like what we're doing with these question labs, and you want that one-on-one attention, and I'll tell you, every student that we've worked with, their scores have skyrocketed. So, keep that in mind, and visit rx-coach.com and take a look at our different pricing and packages available. And if you're interested, sign up for a free consultation. We'll talk to you about the program, give you some success stories, and let you know how we can help you along your journey.